Hello, everybody, and welcome to our question lab. Thank you for spending your Cinco de Mayo with us. We appreciate having you, and we're going to be discussing respiratory today. Before we get into it, let's introduce some people. First and foremost, we have Dr. Paris Vacaria, who will be leading tonight's discussion.
Hi, everyone. Thank you, Sean. I've been an RX coach for about 3/4 of a year now. And I initially went to pharmacy school, graduated from there in Missouri, went back home to Michigan, completed medical school, and am now doing my residency in dermatology at UT Southwestern here in Dallas, Texas. I'm happy to be with you guys tonight and happy to go through some questions.
Excellent. And we also have with us Dr. Christine Lemiguin.
Hi, everyone. Happy to be here. My name is Dr. Christine Lemiguin. I'm an assistant professor of pathology at Lake Erie College of Osteopathic Medicine in Erie, Pennsylvania, and I'm happy to answer any of your questions. So go ahead and ask questions in the box.
And last but not least, we have another one of our RX coaches, Kasha Bornstein.
Hi, everybody. My name is Kasha Bornstein. I'm a third-year medical student at the University of Miami School of Medicine down here in scenic Miami. I got my master's in pharmacology at Tulane prior to medical school. I was a paramedic for just about 10 years before that. So I've been with RX for just about a month now. I'm excited to be moving forward. Nice to meet you.
Excellent. Well, we also have some other panelists with us that'll be helping answer your questions. And if you guys look at your GoToWebinar panel, you'll see a question box, and you can type your questions in there, and our wonderful panelists will do their best to answer those questions for you. Now that you've met us, let's get a chance to meet you. So I'm going to go ahead and ask you guys a question. And the question is, what exams are you guys currently preparing for? So take a second there. You should see a poll on your screen, and please select an answer. This is the same format that we'll be using for our questions as well. So you'll be seeing some polls throughout. This is the first of 5 total polls. I'll give you guys a couple seconds to respond, and then we'll get underway. Keep in mind that at the end of tonight's dissection, we will be giving away some free stuff and giving you guys a very special offer. So make sure you stick around until the very end. You must be present to win. So some of you guys are gonna get lucky and walk away with some free stuff in addition to all the knowledge we're gonna give you today. Well, it looks like a lot of you guys are studying for step 1. We've got some COMLEX and some CBSAs, step 2, and school exams. So thank you guys all for joining us. So we mentioned ExCoach earlier. ExCoach is our new one-on-one individual tutoring program, and we'll talk about that more throughout the course of the evening. And as you know already, Dr. Vacaria and Kasha Bornstein are 2 of our RX coaches. If you're interested in one-on-one tutoring, some personalized guidance to help you with your study plans, to help you with question dissections, to help bridge those knowledge gaps and give you that ultimate edge, feel free to visit www.rx-coach.com and schedule a free consultation to discuss our tutoring program. We look forward to speaking with you. That being said, we're going to be doing 4 questions tonight on respiratory, and we're going to be employing the same methods that we use in ExCoach. So you guys will get familiar with those here today. As you can see, I have already removed the answer choices for you from this question, and that's by design. That's because the first thing we like to do when we're dissecting questions is to cover up those answer choices. The reason for that is because we don't want these answer choices to dictate your thinking. We don't want you to be guided by what you're reading, and we definitely don't want you to see an answer choice you're not familiar with and then start panicking while you're reading the question. So we cover up those answer choices, and then we read the lead-in or the last sentence first. So I'm going to do that now. Which of the following factors is most likely to result in a similar shift in the oxygen hemoglobin dissociation curve? Now, the reason why we read that last sentence is because we want you to know what the question is asking. So while you read the stem, you can pick up on those pertinent clues, avoid those distractors, and prevent yourself from having to reread that question, wasting valuable time on test day. So once you read that last sentence, we'd like you guys to think, is this a 1-step question, a 2-step question, or a 3-step question? A good example of a 1-step question could be a question where they ask you, what's the diagnosis? An example of a 2-step question is when they ask you, what's the treatment for a diagnosis. And an example of a 3-step question is, what's the mechanism of action for the treatment for that diagnosis? So I want you guys to think to yourselves and ask yourselves, how many steps will this going to require? Which of the following factors is the most likely to result in a similar shift in the oxygen hemoglobin dissociation curve? Now we're going to read that stem. And in our tutoring sessions, we will stop after each sentence, ask you to think out loud, ask you what's on your differential, what clues you want us to highlight, and what you're picking up on, and get your thought process. Since we don't have time to do that today, I'll stop briefly after each sentence to give you a second to gather your thoughts. A 26-year-old professional cyclist wants to maximize his performance by enhancing his condition. He decides to move to Leadville, Colorado, elevation 10,000 feet, and trains there for 3 months. This change in altitude leads to a new shift in the oxygen hemoglobin dissociation curve. And now we'll read that last sentence again. Which of the following factors is most likely to result in a similar shift in the oxygen hemoglobin dissociation curve? Dr. Viccaria.
Thank you, Sean. So I'll go ahead and read out the answer choices really quickly. Now, it's important that we like to start from the very bottom. So we like to start from answer choice E and then work our way up towards answer choice A. And there are a couple of reasons for this. One, we want to make sure that we're not biasing ourselves as we go through the answer choices. And we want to make sure that we're actually reading through all of the answer choices and not just selecting the one that we like when we immediately come upon it. So this makes sure that we get through all of the answer choices. So let me read through those really quickly. Answer choice E, increased partial pressure of oxygen. D, increased pH. C, decreased temperature. B, decreased partial pressure of carbon dioxide. And A, decreased pH. So we'll give you all a few seconds to gather your thoughts. Sean is going to open up a poll here. Please go ahead and select the answer choice that you think is correct.
Excellent. So we'll give you guys a few seconds here to answer. If you guys aren't sure what the answer is, feel free to pick one, okay? We're going to go through these answer choices in a little bit, one by one, and make sure you understand why the wrong answer is wrong and why the correct answer is correct. And we like to do that in our coaching sessions also, because we do want you to start learning from these practice questions, but also we want to see if we can help you identify a pattern as to why you're missing these questions. And we do that in our coaching program, and we've had a lot of success with it. Looks like only about half of you guys have voted so far. I'll give you guys a few more seconds. A lot of you guys are on the right track though, so don't worry if you don't know it. Just take your best guess and we'll go over these choices here together shortly. Excellent. I'm going to close this poll. Let's see how you guys did. Looks like 59% of you picked decreased pH, and runner up there with 22% was increased pH, on opposite ends of the spectrum. So let's see which answer is correct. And the correct answer is A, decreased pH. And I'll hand it over to Dr. Viccaria, who will explain these choices to you.
Thank you, Sean. So this question told us about a 26-year-old male who has been training for 3 months at a high altitude of 10,000 feet. Now remember, as altitude increases, barometric pressure decreases. So this leads to a lower inspired partial pressure of oxygen, or PO2. Once again, a lower inspired PO2. In response to this, the body undergoes a few physiologic changes to help preserve oxygen delivery to the tissues. So the immediate response is we hyperventilate. However, when you're there for a few days or chronically like this male was, you're going to see some other changes as well. This includes primarily an increase in 2,3-bisphosphoglycerate. Once again, an increase in 2,3-bisphosphoglycerate. This allows for more offloading of oxygen at the tissues. How does it do that? Well, it raises the PO2 at which oxygen begins to dissociate. Therefore, the oxygen hemoglobin dissociation curve would move to the right. Once again, 2,3-bisphosphoglycerate raises the PO2 at which oxygen begins to dissociate. Therefore, you would see a rightward shift in the dissociation curve. Can you guys name some other physiologic things that would also cause a rightward shift in the oxygen hemoglobin dissociation curve? As Sean mentioned, there is a question box on the right side of your screen. If you want to go ahead and open that up and then post some things that you think or you know can also cause a rightward shift in this curve, and we'll give you all a few seconds to do that.
Excellent. So we'll look forward to those responses. Looks like, a lot of you guys got this question right. If you didn't get it right, don't worry. We're here so we can learn and get it right on test day. So, hopefully you guys will learn from this and we'll do better next time. Looks like we have some responses in. So Dr. Vicaria.
Great, thank you, Sean. So some other things that would cause a rightward shift of the oxygen hemoglobin dissociation curve include decreased blood pH, increased PCO2 or partial pressure of CO2, and increasing temperature. Because decreased pH is one of the things that would also lead to a rightward shift of this curve, that is why answer choice A, where decreased pH, is a correct answer here. Now let's review why the other answer choices are incorrect. Answer choice E, increased partial pressure of oxygen. This would not shift the curve to the right and actually wouldn't have any overall effect on the binding of oxygen to hemoglobin, and thus this is an incorrect answer. Answer choice D, increased pH. This would actually result in the curve shifting to the left and would lead to an increased affinity of hemoglobin for oxygen. Thus, you would only have hemoglobin unloading oxygen at low PO2 levels, which is the opposite of what happens when you're training at high altitudes. Thus, this answer is also incorrect. Answer choice C, decreased temperature. As mentioned, increased temperature results in a rightward shift, so decreased temperature would result in the curve shifting to the left, and is also an incorrect answer in this question. Lastly, answer choice B, decreased partial pressure of carbon dioxide. This also results in a shift to the left of the oxygen hemoglobin dissociation curve and is also an incorrect answer. So the takeaway point here is that it's important to remember what physiologic situations cause either a rightward or leftward shift in that oxygen hemoglobin dissociation curve. Here is a helpful mnemonic that can help you remember some of those physiologic changes that cause a rightward shift in that curve. And it goes by cadet face right. So cadet, C as in carbon dioxide, increased carbon dioxide, A for acidosis or decreased pH, D for 2,3-bisphosphoglycerate, and E, elevation or exercise, which can lead to decreased pH, increased CO2, and then temperature increase as well. So these are all things that can cause a rightward shift in your oxygen hemoglobin dissociation curve.
Excellent. Thank you so much, Dr. Vicaria. So hopefully you guys took away something from that question. It was a relatively easier question compared to some of the other ones we're going to do today. So just giving you a heads up. But nonetheless, a very high yield point, a highly tested point, it's something you'll need to know not only on your exam, but also in practice. Because remember, our goal here at Scholar-Rx and USMLE-Rx is to create great physicians. So let's move on now to question 2. So once again, you'll notice that the answer choices are covered up. For those of you who joined us later, this is by design. We don't want you to be guided by the answer choices. We don't want you to be distracted by them. And we don't want you to see an answer choice that you may not be familiar with, causing you to panic. After you've covered that up, we'll read the last sentence out loud. Which of the following is most likely to be normal in the patient? Which of the following is most likely to be normal in the patient? Let's read this down. A 66-year-old man admitted to hospital 1 day ago because of E. coli urosepsis presents with new onset shortness of breath and somnolence the morning after admission. He originally received 1 liter of fluids in the emergency department and was started on piperacillin, tazobactam. He had been otherwise healthy and takes no other medications. His mother had a myocardial infarction at age 64. His father died of congestive heart failure. Temperature is 37.3 degrees Celsius or 99.3 Fahrenheit. Blood pressure is 100/60. Pulse is 95. Oxygen saturation is 87 on 6 liters of oxygen. On physical examination, jugular venous pressure is 7. His breathing is labored and rapid, and diffuse crackles are heard in both lung fields. Cardiac examination is normal, and he has no peripheral edema. Urine output has been 0.8 since admission. Blood work shows white blood cell count of 14,000. BNP is 30, and 2 draws of troponin 2 hours apart are negative. EKG shows no abnormalities, and chest X-ray is shown. The patient is intubated and placed on mechanical ventilation. Which of the following is most likely to be normal in this patient? Dr. Vicario.
Thank you, Sean. So again, we will start at the bottom and work our way up. Answer choice E, PaO2 over FiO2 ratio. Answer choice D, lung compliance. C, left ventricular end diastolic pressure. B, diffusing capacity of carbon dioxide or DLCO. And A, alveolar arterial gradient or AA gradient. We'll give everyone a few seconds to gather your thoughts. Please go ahead and select an answer choice that you think is correct, and we will go over it in just a bit.
Excellent. So I see that only about 10% of you guys have answered so far. So we'll give you guys a couple seconds to input your responses. While you guys do that, keep in mind that, when you take the test, knowledge is important, but so are test taking skills. And we really do work on that in ExCoach to help you with those question dissection skills, to make you a personalized study plan, because as you guys know, everybody learns differently. Everybody has different strengths and weaknesses. So we want to give you this all-star coach, this experienced and trained coach to work on you individually to help you get that edge on test day. And for those of you who didn't get this question right, we'll find out in a second, coaching might be a good option. Let's see how you guys did. Looks like 45% of you picked C, left ventricular end diastolic pressure, and second place was DLCO. So looks like we had a decent amount of responses here. We're going to see what the correct answer is. And the correct answer is C, left ventricular diastolic pressure. Looks like about 45% of you got it right. So let's see why that is the correct answer and why the other ones are incorrect. Dr. Vicario.
Thank you, Sean. So we are told in this question that this patient is a 66-year-old man who has gram-negative sepsis. He now has, from what the question is telling us, new onset shortness of breath and also has low oxygen levels, even though they are giving him supplemental oxygen. They told us on examination he has diffuse crackles, and now he is intubated and on mechanical ventilation. He was intubated because he developed that hypoxemic respiratory failure that we just mentioned with bilateral diffuse infiltrates that we saw on that chest x-ray. The question also gave us very helpful clues that basically told us he did not have signs of fluid overload. Once again, the question gave us many clues that he did not have signs of fluid overload. Can you guys post in that question box some of those clues that you found that told you that he does not have a fluid overload state? And we'll give everyone a couple seconds to go ahead and do that.
And it's important, especially in questions that are long like this, to pick out those clues and isolate them and know what's important and know what's not important. Because there's so much information there that sometimes students can get distracted and miss clues or not remember them when they're answering those questions. So once again, a test taking trick and strategy that we'd like to go over with our students as part of ExCoach. So we've given you guys some time and looks like you got some great responses. So Dr. Vicario.
Yes, absolutely. So some of those clues are, they told us that he does not have JVD, his jugular venous pressure was normal. He has a normal BNP, normal EKG, no cardiac history, and he's only received 1 liter of fluids. Thus, this makes cardiogenic pulmonary edema unlikely. So those diffuse infiltrates in the lung are likely not from a cardiogenic etiology. These are all important clues that will guide us to the correct answer. So his presentation at this time now, especially because he is intubated and on ventilation, is most concerning for ARDS, or acute respiratory distress syndrome. In this case, he was at risk for developing this because of his sepsis. So ARDS is an inflammatory process that, long story short, leads to diffuse alveolar damage and a lot of interstitial edema. And that's what we ended up seeing on that chest x-ray. So this leads to decreased lung compliance, impaired gas exchange. The diagnosis of ARDS, it's characterized by a PaO2 FiO2 ratio of less than 300 and bilateral infiltrates on chest x-ray. And that's commonly referred to as the whiteout that you would see on chest x-ray. Now, cardiogenic pulmonary edema can look very similar to that on imaging. However, we just talked about how we have ruled that out. Thus, if the patient does not have cardiogenic pulmonary edema, his left ventricular end diastolic pressure is likely to be normal. And thus, that is why answer choice C is the correct answer here, because keep in mind, the question is asking us which of the following is likely to be normal. And that would be answer choice C. So let's review why the other answer choices are incorrect. E, PaO2 over FiO2. We just mentioned how in ARDS, PaO2 over FiO2 is classically decreased to less than 300. And this is because of impaired gas exchange over that alveoli. So even though you may increase your FiO2, it only leads to limited improvement of the PaO2. Thus, this is likely to be abnormal and not the correct answer in this question. Answer choice D, lung compliance. This is also likely to be decreased in this patient or abnormal. And this is due to the interstitial edema that we talked about and the atelectasis as well that happens in ARDS. So thus this is an incorrect answer as well. We just talked about how C is the correct answer, so we'll move on to B, DLCO or diffusing capacity of CO2. So this is also likely to be reduced or abnormal in this patient. And this is again due to those fluid-filled alveoli and that thick hyaline membrane within the lungs. And that's what would be seen on chest x-ray. Thus, this is also likely to be abnormal and incorrect answer. And lastly, the AA gradient or the alveolar arterial gradient. This is likely to be elevated in this patient and thus abnormal. Why is that? Well, the patient has a low oxygen saturation, even though we are supplementing him with oxygen. This is likely due to all that pulmonary edema that is going on that is creating that gradient mismatch and that ventilation perfusion mismatch as well. So because of that, this is likely to be abnormal or elevated and an incorrect answer in this question. So the takeaway point here is that we needed to pick up on those subtle clues in this question that pointed us away from cardiogenic pulmonary edema and towards ARDS. Once we did that, we could easily figure out the question. So make sure you are picking up on those clues because that will help you a lot in that question answering process. Back to you, Sean.
So we've done 2 questions now, we've got 2 left. And remember, we're going to be doing a giveaway at the end. And we're going to be giving you guys a very special offer that hopefully you guys can utilize and take advantage of. Question 3. Once again, you'll notice that the answer choices are covered up. Which of the following is the cause of this patient's disease? Which of the following is the cause of this patient's disease? A 35-year-old woman comes to the emergency department because of shortness of breath and pale blue lips and fingertips. Her history includes a myocardial infarction for which she currently takes sublingual nitroglycerin and a urinary tract infection for which she was prescribed cotrimoxazole 1 day ago. She has a 20-pack year history of smoking, and her diet is heavy in processed foods and deli meats. Physical examination shows central and peripheral cyanosis. Lab tests reveal a PaO2 of 65, a normal AA gradient, and chocolate-colored blood on bedside filter paper. Which of the following is the cause of this patient's disease? Dr. Beccaria.
Thank you, Sean. Once again, we will start at the bottom. Answer choice E, increased oxidized iron. D, increased deoxyhemoglobin. C, increased carboxyhemoglobin. B, increased blood pH. And lastly, A, G6PD deficiency. Once again, we'll give everyone a few seconds to gather your thoughts. Sean's going to go ahead and open up that poll. Please go ahead and select an answer choice from that poll.
Excellent. We'll give you guys a few seconds to answer. Looks like the answers are coming in relatively fast this time. We've got 6 choices, and we'll review them together shortly. So once again, if you guys are liking the question dissections, if you want some help, want some subject-based help, that individualized study plan, some one-on-one coaching to get that edge, please feel free to book a consult at rx-coach.com. I know earlier we talked about ARDS, and that's coming up a lot in the news now because of coronavirus. And there's a lot of you guys out there that are maybe lacking some academic support or structure, some that are lost about what they should do, or some people that want to use this time to study and get ahead, and all of that is great. And we wish you well, and we are here to help in any way we can. So please do take a look at rx-coach.com. Schedule that free consultation if you want to work with one of our tutors like Paris or Kasha. We'll be happy to talk to you about our tutoring program. Let's see how you guys did. Looks like a third of you picked increased carboxyhemoglobin, and 18% of you picked increased deoxyhemoglobin, but the number one answer choice by a sliver was increased oxidized iron, with 34% of you picking answer choice E. Let's see which one was correct. Answer choice E is the correct answer, increased oxidized iron. About a third of you guys got that right. So let's see why the wrong answers are wrong and why the right answer is in fact the correct answer. Dr. Beccaria.
Thank you, Sean. So this woman is presenting with a few things. She's presenting with shortness of breath and pale blue lips and fingertips. This is consistent with cyanosis. They told us that she is currently taking nitroglycerin because of a previous MI. And this question is begging us to assess for a possible adverse drug reaction. So her signs of cyanosis and chocolate-colored blood immediately point to a diagnosis of methemoglobinemia, and we'll talk about that in just a second. So methemoglobinemia can be induced by nitrates as well as a few other drugs. Can you guys name some of those other drugs that can induce methemoglobinemia? Go ahead and open up that question box. Feel free to post what you think are some other drugs that can do that, and we will talk about it in just a second.
Looks like a lot of you guys have some really good thoughts here, getting some great responses. A lot of you guys are on the right track, so that's good news. So even though only about a third of you guys got it right, it looks like you guys have a solid basis here. This was a challenging question, so don't worry if you got it wrong. Like I said, the goal is to get it right on test day and learn from our mistakes. Dr. Beccaria.
Yep, thank you, Sean. So outside of nitrates, there are a couple other drugs that can cause methemoglobinemia. Most commonly, anesthetics, including topical anesthetics, as well as dapsone as well. So these are some other drugs that you should keep in the back of your mind. So let's go back to this question and what's going on. So what is methemoglobinemia? Hemoglobin contains iron in the reduced state, normally Fe2, and oxidized hemoglobin, or Fe3+, does not bind to oxygen as strongly. In methemoglobinemia, you have more oxidized hemoglobin, or oxidized iron. As a result, you are not able to bind oxygen as strongly, and you get hypoxia and decreased O2 saturation, which is what they told us in this question. With methemoglobinemia, the arterial blood characteristically has a chocolate brown color as compared to the normal bright red oxygen containing arterial blood. So that's why the blood looks chocolate covered, and that's why it is relatively specific for methemoglobinemia. Now let's review why the other answer choices are incorrect. Answer choice D, increased deoxyhemoglobin. While this can cause cyanosis, you would not see that chocolate colored blood that they mentioned to us at the very end. And that is a very important clue that Sean is currently highlighting right now that led us to the diagnosis of methemoglobinemia, and thus answer choice D is incorrect. I know a lot of people picked answer choice C, so let's talk about that. Increased carboxyhemoglobin. This can increase as a result of carbon monoxide binding to hemoglobin, which, as we know, actually has a greater affinity than oxygen. However, this presents a little differently. Most importantly, you don't have chocolate colored blood. And we were also told about a couple, and there are, not in this patient, but a couple other physical exam findings you would see that would tell you that. So they would have potentially cherry red lips and skin, none of which this patient has. And there are also no potential risk factors told to us about potential carbon monoxide exposure. Thus, this answer choice is likely incorrect. Answer choice B, increased blood pH. Increases in blood pH would also demonstrate a similar effect to that of carbon monoxide poisoning. Oxygen would bind more tightly to hemoglobin, and oxygen delivery would decrease to the tissues. However, this does not explain the extremely low PaO2 that we were seeing of 65, and also does not explain that chocolate colored blood. The two very important clues here in this question that Sean is currently highlighting. And then lastly, answer choice A, G6PD deficiency. I don't believe a lot of people selected this answer, but this is an X-linked recessive disorder where the red blood cells are very susceptible to being lysed or basically broken up by oxidative stress. These commonly arise after infections, taking sulfa drugs, classically taking fava beans. This patient does not show any signs of having red blood cell lysis like indirect bilirubin elevation, hemolytic anemia, jaundice, and thus this answer choice is likely incorrect as well, thus making answer choice E the correct answer. So the takeaway point here is that this question was begging us to assess for an adverse reaction. It's important to know when that is occurring in questions and to also use those clues such as chocolate colored blood and other clues with other side effects that can help point you in the right direction.
Excellent. And, that was a challenging question, but, we learned from it. We got one question left. We've done 3. We've got 1 left. At the end, like I said, we're going to give away some free stuff and have a very special offer for you guys. So make sure you stick around. Additionally, be sure to check out www.firstaidteam.com if you guys want help with a study planner or some additional resources. And once again, if you're having trouble with any subject, be it respiratory or something else, we can actually tutor you on that subject and do question dissection specifically on that subject. So if you're interested in learning more about our tutoring program, rx-coach.com, you can schedule a free consultation. And I see several of you have already begun to do that. So I look forward to speaking with all of you. Let's move on now to our last question of the evening, question 4. Once again, we will cover up those answer choices like I've done, and we will start by reading the lead-in or the last sentence. What is the mechanism of action for the drug of choice for treating this condition? So once again, think to yourselves, is this a 1-step question, a 2-step question, or a 3-step question? What is the mechanism of action for the drug of choice for treating this condition? Let's read the stem. A 60-year-old man presents to the clinic because he has been feeling unwell for the past week. His symptoms include difficulty falling asleep, a productive cough, and drenching night sweats. Past medical history is significant for severe persistent asthma, which is poorly controlled on high-dose oral glucocorticoids. A chart review reveals a 10-pound weight loss since his last office visit 3 months ago. Vital signs are temperature of 100.8 degrees Fahrenheit, blood pressure of 98/62, pulse of 90, respiratory rate of 22, and oxygen saturation of 90% on 2 liters of oxygen. CT scan of the chest is obtained. It shows abscesses in the lungs. A purified protein derivative, PPD, skin test is negative. An acid-fast stain of the patient's sputum is revealing. And you guys can take a look at the image there. I'll give you guys a second. Now we will move on to the answer choices. Dr. Beccaria.
Thank you, Sean. Answer choice E inhibits peptidoglycan cross-linking to block bacterial cell wall synthesis. D inhibits formation of the initiation complex by binding to the 30S ribosomal subunit and causing misreading of mRNA. C inhibition of dihydroapturate synthase. B decreases synthesis of mycolic acids. And A binds ergosterol and forms membrane pores. We'll give everyone a few seconds to go ahead and think of their answer and then select an answer choice on the poll.
Now, as you guys can see, some of these answer choices, we haven't put the entire answer choice there because it was too long, but you guys should still be able to see your screen. So take a second here, pick an answer choice, and then let's give away some stuff and have a special offer. By the way, we do this question lab every week. We'll have one again next week, and the topic then is going to be epidemiology, so be sure to join us. Looks like only a third of you guys have voted so far and selected an answer choice. I'll give you guys a couple more seconds. Looks like some of you guys might be struggling a little bit with this, but that's okay. Just pick an answer choice, take your best guess, and let's learn together. Well, it looks like about 2/3 of you guys have voted, so let's see how you guys did. Looks like our top answer choice was B, decreases synthesis of mycolic acids, and second place was inhibition of dihydroapturate synthase. So let's see what the correct answer is. And the correct answer is C, inhibition of dihydroapturate synthase. And Dr. Beccaria will now explain to you all these answer choices and why this one is correct.
Thank you, Sean. Yeah, this is definitely a little bit more challenging question. So this patient, he has a few very concerning symptoms. And let's review some of them that they mentioned in those first couple sentences. They told us he has a productive cough, fever, drenching night sweats, which is never a good thing. He also has recent weight loss. They also told us that he has been on high-dose oral steroids for his asthma. What do you think they are getting at by telling us that information that he is on high-dose oral steroids? Post in the question box below what you think they're trying to tell you with that, and then we will talk about it in just a second.
You know, it looks like only about 20% of you guys got this right. So about 80% of us, therefore, didn't get it right. That's okay. Once again, if you guys need that help, if you guys have certain areas or subjects that you guys are just struggling with, feel free to let us know via rx-coach.com. We'd be happy to help. We've helped so many students achieve success. We had just had a student report a score of above a 250. So, you know, definitely our program is working. We'd love to help you guys. Excellent, Dr. Beccaria.
Thank you, Sean. So what they're trying to get at by telling us that information about the high-dose steroids is that he is considered immunosuppressed. So he is at risk for an infection. His symptoms of fever, cough, drenching night sweats, and the recent weight loss should raise suspicion initially for TB, or tuberculosis, Mycobacterium tuberculosis. However, they told us in the second to last sentence that his PPD skin test is negative. So this helps rule out TB. They also told us that he has numerous abscesses in the lungs and showed us an image of a weakly positive acid-fast stain. This should make you think about nocardia asteroides, or nocardia for short. Nocardia infections are known to present in people who are immunocompromised, as is this patient. It is a gram-positive, weakly acid-fast bacteria that forms those long branching filaments that you saw on that image. The findings on CT that they mentioned to us of many abscesses in the lungs is suggestive of pulmonary nocardiosis, or essentially a nocardia infection of the lungs. Now, what is the treatment of choice for pulmonary nocardiosis? That would be sulfonamides. Of these sulfonamide drugs, they act by blocking nucleotide synthesis by what is listed in answer choice C, inhibiting dihydroopteroate synthase, which is why answer choice C is the correct answer. Now let's review some of those other answer choices and why those are incorrect. Answer choice E inhibits peptidoglycan cross-linking to block bacterial cell wall synthesis. This is referring to penicillin and penicillin-like drugs. These are used primarily in the treatment of gram-positive and some gram-negative infections. The causative organism identified by this patient's sputum culture demonstrates some sort of branching pattern that we talked about. Now, this could resemble actinomyces, which is treated with penicillin, and which is potentially why some people selected answer choice E. However, actinomyces normally causes oral and facial abscesses rather than pulmonary abscesses. Additionally, with acid-fast staining, it is not, they do not stain, actinomyces does not stain, unlike nocardia, which is weakly positive to acid, the acid-fast stain. So thus answer choice E is likely incorrect. Now let's talk about D. Inhibits formation of the initiation complex by binding to the 30S ribosomal subunit and causing misreading of the mRNA. This is referring to aminoglycosides. These are used primarily for the treatment of gram-negative infections, especially gram-negative rod infections. They are weakly acid-fast. However, in nocardia, those are weakly fast acid organisms, and that is suggesting nocardia and not a non-acid-fast staining gram-negative rod. Thus, answer choice D is likely incorrect as well. We talked about how C is the correct answer, so let's talk about B. Decreases synthesis of mycolic acids. So this is referring to drugs such as isoniazid. Isoniazid, as I'm sure many of you know, is used to treat and provide prophylaxis against TB or Mycobacterium tuberculosis. The presentation and causative organism is very similar to what is going on in this patient. However, keep in mind that the PPD skin test, as they told us, is negative. Thus, that would rule out TB and make you lean away from answer choice B, which is likely an incorrect answer in this question. And lastly, answer choice A binds ergosterol and forms membrane pores. This is referring to amphotericin B. This is often used to treat fungal pneumonia, which can manifest with similar symptoms. However, the sputum staining and acid-fast stain suggests that this is not a fungal infection and likely an incorrect answer. Thus, the takeaway point here is picking up on all those clues that we had mentioned previously, and then also having a good differential of what to consider in terms of pulmonary infections, but also just bacterial, fungal, and other infections as well.
Excellent. So that was a challenging question, and it was a three-step question. And so you had to figure out what was going on, then what the drug was, and then what the mechanism of action was. And that's why it's so important to have a consistent approach to these questions, because some of these questions are very challenging, but they're doable, and we can get them right, and we can do well on test day. So with that being said, I know we mentioned ARDS earlier, and I want to show you guys another resource that you guys can use for additional review. And here's a brick, an RX brick, one of our newest resources on ARDS. So as you can see here, the brick will start off with learning objectives. It'll define them for you. And then as you scroll down, you'll have a content review. Okay, so get to learn about ARDS. What is ARDS? You will also see some clinical correlations as they relate to the brick itself. And then you'll be able to test yourself with these little flashcards to make sure that you're actually understanding what's going on and what you're covering. You continue to learn that content and practice with additional flashcards. Mnemonics are present when they're relevant. And then as you finish this brick and you scroll down to the bottom, you're going to see a summary of what we hope you took away from that brick. And then you can do some practice questions to make sure that you're comfortable with that content. And then at the end, you'll be able to review those learning objectives and mark off your confidence levels for these objectives. And if you want to go deeper, then you can scroll down here. It'll tell you exactly where to find it in our other resources. It's there in Flashbacks, as you can see. It's there in Express Videos and in QMax, along with some time estimates of how long it would take you to go deeper in those subjects in our various resources. So be sure to check out RX Bricks along with RX 360. And here shortly, some of you guys will become lucky winners. And for those of you who don't win, don't worry. We're going to do another webinar and question dissection next week.